We're here with Dr. Christopher Asandra. He's the medical director at the NuMale Medical Center. A lot of people don't understand how widespread the problems that men face, whether it be the nether regions or just overall aging. What are the biggest issues as you move into that 40, 50, 60 category?
Well, one of the biggest things I hear a lot from these guys is that I'm losing my energy. I don't feel like I used to in my 20s, my 30s. I'm losing my mojo. I work out at the gym all the time and I can't get the muscle that I used to be able to put on easily. Or I'm at work, I tire by the end of the day, I fall asleep on the couch when I come home. And usually that's due to a hormone imbalance issue or just the natural process of aging.
Is it just that as you age, the hormone kind of disappears?
Yeah, we actually lose about 1% to 2% of our testosterone every year, men do. But certain things can accelerate it. Diabetes, stress, and everything else, that can really affect it and really bring you down as well.
Here at the NuMale Medical Center, you have a remedy for that though. There's a way of fixing it. All hope is not lost.
Absolutely, and the treatment for that is bioidentical testosterone replacement therapy, medically managed and very safe and effective. We actually check guys' hormones in the office. We get their results back within about 30 to 45 minutes. Most of our centers have this, and we can actually begin treatment that day and institute bioidentical, safe, medically managed hormone replacement therapy or testosterone replacement therapy to get their levels back up to an optimal level where they feel like they're 25 or 30 years old again.
When it comes to treatment, I think people get really freaked out about what exactly that entails.
Sure.
What are we talking about when we're talking about treatment?
Well, treatment consists of running the necessary tests first, finding out where they're lacking certain hormone levels or anything else, and then really customizing the treatment program for the gentleman that comes in. So the important thing is to not only just put everybody on testosterone, but to monitor it and watch it as well as they progress, check their levels and make sure everything's in balance. Not just their testosterone, but their estrogen and all these other hormones in the body to make sure everything's in balance so that they can develop the muscle again, feel better again, and have that energy.
It's kind of remarkable because we used to age, a man used to age and think, it's just the natural course of life that I'm not going to look like a 20-year-old anymore.
Right.
But with this hormone replacement therapy, they can actually reverse the effects of time?
Well, yeah, a part of it is putting on that muscle again. And with lean muscle, you're healthier, your heart's healthier, you're more active, you have energy to get out there, you're more motivated to go out and actually do something. So, how we felt when we were 20 or 25 years old, that's how I want my patients to feel now again.
What could they anticipate in terms of results? Are we talking, you'll be here for a half hour and you'll walk out a new man? Or is this more of an investment of time? You gotta come 3 times a week?
Depends on the person, depends on their lifestyle. I always encourage a very healthy lifestyle. When we start you on these treatments, I always say it's the first day of the rest of your life, okay? When you walk out of here, you gotta make those changes. Eat better, diet, exercise, reduce your stress, all those things play a factor in the overall health of someone. So my medications help you and the hormones help you, but it's really about making that commitment to a lifestyle change overall.
When someone comes in here, what can they expect?
Well, I wanted to create a place where they can feel comfortable talking about these types of issues with a physician or a medical provider, right? There's no waiting. We put you in a room right away so that you don't have to sit out with other people that may be coming in for this type of problem.
There's another issue that you treat here, which is a little bit more severe and almost more uncomfortable for a man to discuss.
Sure.
And we're talking about, obviously, erectile dysfunction. And when we're talking about that issue, because it's so sensitive, what would you be encouraging to people here in Beverly Hills?
Well, they say about 35 to about 40 million men in America actually have some degree of erectile dysfunction. The erectile dysfunction is one of those things that, it's a very personal issue. It defeats a man. The self-confidence goes down and everything else. So we have, every year it grows. And it's a growing problem, excuse the pun. But more and more men are seeing it every year. As more stress increases, you're going to have more erectile dysfunction. The way we treat it here is a very therapeutic method. We have the most innovative treatments available for it, where we can actually rehabilitate them and hopefully get them working again, besides just giving them a great erection they can use. But having them restore their confidence and their vitality and everything else that goes along with it, they're able to actually function again. We're focused on the problem at hand, not trying to band-aid it with pills.
Right, exactly, because everyone is familiar with the blue pill, but you say that's just a Band-Aid, that's just a quick fix.
It's just a quick fix. When you take a pill, a lot of my patients tell me you got side effects from it. It doesn't work, it didn't really do anything for me. I have a treatment that's 98% effective. It's gonna work immediately. It's gonna work almost every time you use it. And it's also therapeutic. It's gonna heal their tissue down there.
I feel like you're going to get the line out the door with this kind of information. Is there someone that's an ideal client though, or really should every man be checking up on his hormone levels?
You know, I think every man should be checking after the age of 35, 35, you should always check your hormone levels. Whether it's, if you notice different signs, you're falling asleep on the couch when you get home, you don't have that motivation, energy to get out, you're working out at the gym and you're not putting on that muscle or lean muscle or losing the weight, that could be a hormone issue, among other things. But it's something that I encourage all men to get checked out, because if you want to stay healthy and prevent the other medical problems from happening, it's important to optimize your lifestyle and your hormones. The first thing that guys tell me is that mental clarity, brain fog goes away, my energy level goes up, I'm happier, people around me notice I'm happier, and so it doesn't just affect the man, but it affects everybody around them.
Now you moved to Beverly Hills, you're new to the area. Why did you settle on a location here?
We have centers all across the United States, and the more I saw people coming to see me in my Vegas office or from around the country, a lot of people came from the Southern California market. And I think it's about time that these services are offered here in this area, because there's not a lot of choices when it comes to this type of thing, this type of treatment and therapy. And I'm just really proud to be here and happy to offer the services to the male market here.
Thank you so much, Dr. Asandra. Hopefully the men in Beverly Hills will recover and you'll move on to another area of Los Angeles.
Thank you so much for having me.